Yeah.
If you want to know exactly what not to do
Yes.
ethically,
Yes.
watch that. We can show it in our ethics classes, right? Of these are the things not to do.
Hey, everybody.
Hello.
So I'll tell you my full name, Cleo Townsend, and I started out as an adjunct professor. I am now full-time assistant professor, but prior to that, I have been a licensed marriage and family therapist for 13 years, and I've been a pastoral counselor for over 25 years. And so
Nice.
I love what I do. I have a small private practice in Delaware, and mainly we provide intervention and consultation to the state of Delaware. But I do see a small group of favorite clients.
Awesome.
All right. Well, hello. I'm Weston Crafton, and I've been with Capella since 2020. Adjunct, kind of like how you started as an adjunct faculty, and then I rolled into full time as an assistant professor. I have a private practice in Nashville, Tennessee, and I've been there for 10 years practicing with couples, individuals, and families. And so that is my specialty, working with in marriage and family.
Awesome. I'm Dr. Candice Crawford. I am a licensed mental health counselor in the state of New York. I have been a licensed counselor for well over 10 years now, have been an assistant professor at Capella now for 3 years. It feels like a longer time than that, but it's been a few years being at Capella. I have a private practice in New York where we primarily work with women of color who've endured trauma, and that's a work that I really enjoy doing and really kind of contributing to the community and giving back in that way.
Cool. Great. That's great. So hello, I'm Dr. Leigh Bagwell. I also have been with Capella since 2022 and agree, it feels like it's been longer. I'm assistant professor with Capella. I come from the world of school counseling. So prior to being at Capella and working, helping train up the next generation of school counselors, I have spent about 25 years in the K-12 space as a school counselor in Tennessee, not far from where Weston is. I've been a school counselor in elementary, middle, and high schools. I've been district directors in and around Middle Tennessee. I was a state director of school counseling. And so very, very passionate about school counseling and how we can address the mental health of our K-12 students and support them and their families in addressing mental wellness in that space. So just, real excited to be here and to talk about this really important topic with you guys today.
Yes, wonderful. Now, we, all four of us, help people, and we enjoy it, and we also help people with their emotional and mental well-being. However, there's some distinction with what we do, and so there's some confusion out about what the differences are between clinical psychology, licensed marriage and family therapist, clinical mental health counselor. So if you were to describe it to someone, how would you describe what you actually do?
Yeah, I think for me, I say that I treat mental health issues, problems, but I do that within the context of marital and family systems. So for me, I'm a specialist in a sense that I'm going to look at it systemically. So it's not like if you have, if someone comes in and says, I'm experiencing depression, I'm going to say, well, tell me about, how does this depression show up in your family relationships, in your couple relationship, or how is it impacting you at work? And so I'm going to be really curious about not just what's happening within the person, but what's happening all around in between the person and their relationships.
We hear that word therapy a lot, and so I say that there's that umbrella of therapy, and then we have the counseling, we have the social workers, the psychologists, and I like to say that we're cousins, right? So we do a lot of very similar things, and I won't speak for your field or your industry or specialty more specifically, but as a counselor, we really look at the holistic approach of how to treat our clients.
I love that description, that kind of umbrella picture, that metaphor, because I think it's really important. I know in the school setting, we see the impact of that lack of clarity a lot, particularly when we have parents come in and want to get support for their students, and they just don't understand the different roles. And, I think that we've not done a great job of really differentiating that and helping them see that, the counselors were looking kind of at that holistic approach. I think, they wonder, do we diagnose? Do we give medication? Do we do those things? And, helping them understand, that psychiatry looks at medication, that's not our role. And then even within the world of counseling, school counseling is very distinct in what our scope is. School counselors, we say we don't do therapy. It's not an ongoing service. We look at short-term, brief counseling, really focusing on what barriers the students are facing that's impacting their ability to be successful in a school setting.
Leigh, you said something about the need to educate families, parents about the distinction with the mental health. And so I had a thought.
Yeah.
So Candice, you mentioned about holistic, and then Weston, you talked about systems. And so can you give clarity to the difference between that, or is it the same? Marriage and family therapy dealing with systems in the context, and you're saying holistic.
So if we were to sum up what we do in just a few words, I would say that for me, I'm helping people take their masks off, take their hats off, like really get down and see themselves objectively as the best they can. So I'm trying to really help them to see what are the scripts they're living out, who's writing those scripts, the traumas that they're bringing in. A lot of the relationship conflicts that they're bringing into the room. I'm trying to help them just, if in a few words, I would say, take the mask off. And let's just figure out who you really are, apart from all of that, all the problems. You are not you are not the problem. The problem is the problem, right?
Yeah.
Right.
So when I think about therapy, I think about bringing people in and creating a safe space for them to tell me their story. And personally, I believe that people are trying to break out of a story that was created for them. And so I'm there to help them create, stay loyal to some aspects of their story, but create and develop a new one that defines who they are. And I do that in a very safe space, and giving them that voice, to be heard.
I love that idea of creating a new story. I think that's really important. And similarly in school, I think about, it is creating that space to build awareness and to learn skills. I think with kiddos, we're doing a lot of teaching them how to manage themselves, how to explore for themselves, how to learn the skills they need to be successful, how to discover who they are and help them write their own story, to kind of piggyback off of what you were saying.
Definitely.
And it's tough, right? Because, how do we, our clients come in and don't understand what it means to create their own story because a lot of their stories have been created for them, right? And so it makes me think about how therapy shows up in social media, entertainment, and things of that nature, right?
Yeah.
Because again, these stories are sometimes not their own, right? And so thinking about how therapy is shown in entertainment, how do you all think it's like being portrayed?
I think the show in particular, Shrinking.
Oh yeah. Yeah.
If you want to know exactly what not to do ethically,
Yes.
watch that. Watch that show.
Well,
right?
I started it and I had to finish it.
Right,
I couldn't watch it.
Yeah, it's like we can show it in our ethics classes, right? Of these are the things not to do. And there was another show, In Treatment is the name of that show. And the therapist ended up developing a relationship with his patient, and it's just I think for therapists in training, it brings up a lot of good dialogue about the internal, what we call countertransference, right?
Yes.
And the internal
Self of the therapist.
the things going on. So I think that they're good talking points for us to maybe start in our classes, maybe in helping students to learn about that. So.
I think that's good too. They are great talking
points, but that's all they need to be, right?
And also, we could bring out a little bit of prose in that, in the sense that it does depict that therapists are human.
You're right.
That's
That we
right.
have real issues.
Right.
You know,
Right.
the same issues that you deal with. We as therapists, as counselors, we have the same issues. We have the same family trauma. We have deaths in our family. You know, we deal with all that too.
That's right.
However,
Yeah.
we don't disclose to the point where now our client has to take care of us.
Sure.
Yeah,
Right.
That's exactly
Sure.
So
Right.
That's it.
Yeah.
Boundaries are what's lacking in a lot of entertainment,
Yes.
Yeah.
portrayals of therapy. I'm like, how are they doing that? That is not what you do. So boundaries and ethics, I think, gets missed. I will say, I think, in my observation of, portrayals of therapy or counseling in entertainment, I think it's getting better. Right. And I think that that's because there's a lot more accessibility to, people who are going to therapy, people who are getting trained. So I do like that. And then also to your point, Cleo, the idea of that we're humans, right?
Yeah.
So couples therapy, which is based off of a real life therapist who's working with someone.
Yes.
She actually
Yeah.
goes to, clinical consultation and
Yeah.
supervision. And so I really enjoy seeing that piece because I think
Absolutely.
that people don't often know what it takes to be a counselor or a therapist and really get that additional, support, from their peers or their consultants.
Yes, exactly.